Public Health Initiative Media. The objective of this TV screencast is to provide education on two current health concerns in our community: meningococcal disease and salmonella. Meningococcal disease is caused by a bacteria. Although many people carry this bacteria in their nose or throat, they never get sick. Meningococcal disease can affect the bloodstream or brain and spinal cord. Sometimes it affects both the brain and bloodstream. It can be a life-threatening disease unless early diagnosis and treatment is provided. College students, especially freshmen who live in dorms, and military recruits are at an increased risk for meningococcal disease. Each year in the United States, about 1,000 people get this disease. The greatest risk is in individuals between 15 and 21. Students entering college and planning to live in dorms are at a higher risk than other people of the same age for this disease. It is easy for infections to spread in crowded dorms or enclosed areas where students often meet to smoke and drink alcohol. Some of the symptoms of meningococcal disease includes fever, a flat pink to red to purple rash on any part of the skin, especially on the lower legs and feet, nausea, vomiting, generalized muscle aches, sudden severe headache, confusion, sensitivity to light, and stiff neck along with headache. The symptoms of meningococcal disease are often mistaken for less serious illnesses such as the flu. It is important to get medical treatment right away. Meningitis can get worse very quickly, even within a few hours from the start of symptoms. Meningitis is treated with antibiotics. When given shortly after the start of symptoms, these antibiotics may prevent the disease from getting worse. Because this infection spreads to others in close contact, all of those who have been in contact with someone diagnosed as having meningitis should contact their doctor. In many cases, an individual who has been in contact with someone with meningitis may be given an antibiotic to help prevent meningitis disease. Ideally, this antibiotic should be given within 24 hours of exposure to the person with meningitis. There are 3 types of meningitis vaccines available in the United States. If you are a student about to start college, here are some health tips. Reduce your risk for getting meningitis by reducing your exposure to smoking, drinking alcohol, excessive stress, and upper respiratory tract infections. Even if you don't smoke, being exposed to secondhand smoke can still increase your risk of getting this disease. Strengthen your immune system by living a healthy lifestyle that includes enough sleep, exercise, and a balanced diet. Avoid sharing eating utensils or drinking glasses. Cover your mouth when you sneeze and cough, and wash your hands. Get familiar with your college students' health services. Find out who to call or where to go if you feel ill. Remember that your doctor or pediatrician is available to answer any questions you may have about your health. If you need more information, please visit www.nfid.org to learn more about vaccines used to prevent meningitis, or check out the CDC website for a podcast presented by the United States Centers for Disease Control and Prevention. Let's now talk about foodborne illness, salmonella. Salmonella infection is a common bacterial disease that affects the intestinal tract. The salmonella bacteria typically lives in animals and human intestines and are shed through feces. Humans become infected most frequently through contaminated water or food. Typically, people with salmonella infection have no symptoms. Others develop diarrhea, fever, and abdominal cramps within 8 to 72 hours. Most healthy people recover within a few days without any treatment. Some symptoms of salmonella are nausea, vomiting, abdominal cramps, diarrhea, fever, chills, headache, and blood in the stool. Salmonella infection is usually caused by eating raw or undercooked meat, poultry, eggs, or egg products. Signs and symptoms of salmonella infection generally last 2 to 7 days. Diarrhea may last up to 10 days, although it may take several months before bowels can return to normal. A few varieties of Salmonella bacteria can result in typhoid fever, a sometimes deadly disease that is more common in developing countries. Salmonella bacteria lives in the intestines of people, animals, and birds. Most people that are infected by Salmonella usually acquire it by eating foods that have been contaminated with feces. Some commonly infected foods may include raw meat, raw eggs, fruits, and vegetables. The Food and Drug Administration also indicates that some Salmonella outbreaks have been traced to contaminants in spices. The agency is seeking ways to increase the safety of spices. Many foods become contaminated when preparers don't wash their hands thoroughly after using the toilet or changing a diaper. Infection can also occur if you touch something that is contaminated, including pets, especially birds and reptiles, and then put your fingers in your mouth. Salmonella infection can be detected by testing a sample of your stool. If your doctor suspects that you have a Salmonella infection in your bloodstream, he or she may suggest testing a sample of your blood for the bacteria. Salmonella infection can be dehydrating because of the severe diarrhea that accompanies the symptoms. Treatment focuses on replacing fluids and electrolytes. Some cases may require hospitalization and fluids delivered directly into a vein. Additionally, your doctor may recommend an anti-diarrhea medicine such as loperamide, and if your doctor suspects that Salmonella bacteria has entered your bloodstream, or if you have a severe case or a compromised immune system, he or she may prescribe antibiotics to kill the bacteria. The Department of Agriculture has created a Salmonella Action Plan, which involves updating the poultry slaughter inspection system and enhancing sampling and testing programs for poultry and meat. The plan's purpose is to cut the number of Salmonella infections in the United States. You can also take care to avoid spreading bacteria to others. Preventative measures are especially important for preparing foods or providing care for infants, older adults, and people with weakened immune systems. Be sure to cook foods thoroughly and refrigerate or freeze food promptly. Again, wash your hands. Washing your hands thoroughly can help prevent the transfer of Salmonella bacteria to your mouth or to any food you're preparing. Wash your hands after you use the toilet, change a diaper, handle raw meat or poultry, clean up pet feces, or touch reptiles or birds. For more information regarding foodborne illnesses, contact the United States Department of Health and Human Services or your local health department. If you suspect you are ill with a foodborne illness, contact your health provider or visit a local walk-in clinic near you. Thank you very much.